What is gout? Today, we're discussing a topic that affects millions worldwide, gout. Whether you've been diagnosed with gout or just want to learn more about it, this video will provide you with comprehensive information to better understand and manage this condition. Watch till the end. Gout is a form of arthritis caused by high levels of uric acid in the bloodstream. Uric acid is a waste product formed when the body breaks down purines, a type of protein found in many foods and all cells. Elevated uric acid levels can occur due to inefficient removal by the kidneys, rare genetic abnormalities or dietary and lifestyle factors that increase uric acid production. Prolonged high levels of uric acid can lead to the formation of needle-like crystals in the tissues, causing swollen and painful joints. Gout through the ages. The very word gout evokes images of kings and emperors, their indulgence in rich food and drink leading to painful attacks. This association is no accident. Gout has historically been dubbed the disease of kings, and for good reason. Its link to excess, particularly of certain foods and alcohol, made it a common ailment amongst the wealthy. One of the earliest and most vivid descriptions of gout came from the 17th century physician Thomas Sydenham, who himself suffered from the condition. He described the excruciating pain as like a vise being tightened around the joint. Sydenham's writings painted a clear picture of gout's debilitating effects, a reality still faced by millions today. While the association of gout with wealth and overindulgence persists, it's crucial to understand that gout can affect anyone. It is, however, entirely preventable and manageable with the right knowledge and treatment plan. While gout often presents in a typical manner, it's important to recognize that any joint can be affected. With our aging population and the rise in chronic medications, the profile of gout is becoming increasingly complex. Despite the significant advancements in our understanding and treatment of gout, the condition remains a significant health concern. Who is affected by gout? While it's true that certain factors like age and diet can increase your risk, gout doesn't discriminate. Gout is closely linked to hyperuricemia, which is an excess of uric acid in the blood. This condition is often associated with metabolic syndrome, characterized by insulin resistance and obesity. Unfortunately, these factors also contribute to a higher risk of premature death, primarily due to cardiovascular diseases. It can affect anyone, regardless of background. Men are more likely to develop gout than women, and it typically appears in midlife. However, women are increasingly being diagnosed, particularly after menopause. Genetics also play a role, with a family history of gout significantly increasing your risk. Also, there is genetic variability in how effectively the kidney removes uric acid from the body. However, gout is rare in people younger than 20 years of age. Certain ethnicities, such as Pacific Islanders and Northern America, and there is a higher incidence of gout among black minority ethnic groups, likely due to the adoption of Western diet. Gout is not distributed uniformly within the UK, the highest prevalence and incidence of gout being in the northeast and Wales. Some papers have reported that people with non-manual skilled occupations had the highest, whereas professional occupations had the lowest standardized consulting ratio for gout. It's important to remember that gout doesn't always fit neatly into a box. Its presentation can be varied, and what might be typical for one person might not be for another. This makes understanding the full spectrum of gout, from its underlying causes to its diverse symptoms, crucial for effective diagnosis and management. At the heart of gout lies a substance called uric acid. This natural waste product is produced by the breakdown of purines, compounds found in our cells and certain foods. Normally, our bodies efficiently eliminate uric acid through the kidneys, maintaining a healthy balance. However, problems arise when this balance is disrupted. Hyperuricemia, a condition characterized by high levels of uric acid in the blood, is a key risk factor for gout. When uric acid levels rise too high, they can form needle-like crystals that deposit in joints, triggering the painful inflammatory response characteristic of gout. For the typical patient, often a middle-aged to elderly individual, diagnosing gout can be straightforward if certain signs are present, sudden onset of pain, rapid progression of symptoms, peaking within 24 hours. Severe pain, swelling, redness and warmth in the affected joint, usually the first metatarsophalangeal joint, that's the joint at the base of your big toe. But the implications of hyperuricemia extend far beyond gout. It's increasingly recognized as a significant contributor to metabolic syndrome, a cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. When diagnosing gout, your primary care clinician will ask about any recent injuries to the joint, examine the skin for integrity, and look for spreading redness, which might indicate an infection like cellulitis. Consider septic arthritis if the patient appears unwell, is immunosuppressed, has an indwelling catheter, or uses intravenous drugs. Check for signs of psoriasis on the skin, arthritis nodules, or the presence of tophi, deposits of uric acid crystals. Joints already affected by osteoarthritis are more susceptible to gout. This is likely because the degenerative changes in these joints promote the formation of uric acid crystals. High levels of uric acid can lead to a range of issues, from having no symptoms at all to experiencing severe joint and kidney problems. Interestingly, about 2/3 of people with hyperuricemia never develop gout attacks or related complications. When it comes to testing for gout, the two most important are renal function tests, to check how well your kidneys are working. Impaired kidney function is a common risk factor for gout. Identifying this is important because it influences the choice and dosage of medications used to treat both acute attacks and to prevent future ones. Joint aspiration and synovial fluid analysis. This involves taking a sample of fluid from the affected joint to look for uric acid crystals. While this procedure is typically done in a hospital setting, it's crucial if there's a suspicion of septic arthritis. It is the gold standard for diagnosing gout arthritis. Ultrasound has recently been identified as a promising new imaging modality for gout. It is more likely to be available, if required, to aid in the diagnosis of gout. One key sign doctors look for is the double contour sign on the ultrasound. However, in primary care, no investigations are necessary, as the diagnosis is mainly based on clinical history and examination findings. Your doctor will take a detailed medical history, asking about your symptoms, dietary habit, family history of gout, and any medications you're taking. At a follow-up, your primary care clinician will assess cardiovascular risk factors, including weight, blood pressure, diabetes profiling, and uric acid levels. Gout management can be divided into acute gout treatment and preventative measures. A recent UK study found that both naproxen and low-dose colchicine are effective in treating acute gout attacks or flare-up. Naproxen tends to work faster and has fewer side effects compared to colchicine. Ice packs applied to affected joints can provide symptomatic relief. However, NSAIDs should be avoided in individuals with kidney or liver impairment, blood clotting disorders, or those on blood thinners, congestive heart failure, or previous adverse reactions to these medications. If you're taking NSAIDs and have a history of stomach issues or are over 65, your doctor may recommend gastrointestinal protection. Blood tests are crucial for confirming a gout diagnosis and assessing the severity of the condition. Colchicine has been used to treat gout since 1500 BC. The recommended dose is 500 micrograms 2 to 4 times a day until the pain subsides or side effects like diarrhea or vomiting occur. If needed and tolerated, the dose can be gradually increased. Alternatively, steroids can be used. These might be oral steroids like prednisolone or a single injection into the muscle. For those comfortable with the procedure and with a skilled practitioner, an intra-articular injection directly into the joint is also an option. After an acute gout attack, it's recommended to take a convalescent blood sample 4 to 6 weeks later. This allows uric acid levels to return to normal and helps confirm whether hyperuricemia is present. A normal uric acid level does not exclude the diagnosis of gout. It's important to make lifestyle changes to effectively manage gout. Research shows that weight loss can reduce the frequency of gout flares. Moreover, certain foods and drinks can increase uric acid levels. Limit intake of sugar-sweetened beverages, especially those high in fructose. If you consume alcohol, reduce to recommended limits, particularly avoid beer. Avoid excessive consumption of purine-rich foods such as liver, kidney or shellfish. Encourage intake of fluids to more than 1.5 to 2 litres a day. It's noteworthy that while caffeinated drinks can cause dehydration, some studies indicate that coffee might actually help reduce uric acid levels, possibly due to compounds other than caffeine. A gout diagnosis is also an opportunity to assess your overall health. It should prompt a full evaluation of your cardiovascular and diabetes risk factors. If you need to address high blood pressure, specific medications like losartan and calcium channel blockers can decrease uric acid levels and lower the risk of gout. Conversely, thiazide and loop diuretics, as well as beta blockers, can elevate uric acid levels and increase the risk of gout. Moreover, fenofibrate, utilized for high cholesterol treatment, also assists in reducing uric acid. For younger, healthier individuals with good kidney function, lifestyle modifications might be enough to manage gout. However, for older adults with more complex health issues, urate-lowering therapy may be necessary. Deciding whether to initiate urate-lowering therapy depends on the probability of future gout attacks, the severity of urate-related complications, and your personal preferences. The presence of uric acid crystal deposits is an indication of high urate levels and can predict future joint damage, particularly in the hands. Guidelines recommend starting urate-lowering therapy if you have 2 or more gout attacks in a year, tophi or kidney stones, joint damage or impaired kidney function, conditions requiring water tablets, diuretics, genetic factors leading to high uric acid levels. It's also beneficial to discuss urate-lowering options at the time of diagnosis, rather than waiting for recurrent attacks. Keeping your serum urate level below a certain level can reduce flare-ups significantly and resolve tophi more quickly. Allopurinol and febuxostat are the 2 main urate-lowering medications available to your primary care clinician. These medications are usually prescribed for long-term use, so regular monitoring is essential to ensure they're working effectively and safely, especially if you have heart, kidney or liver conditions. For allopurinol, doctors typically start with a low dose and gradually increase it, up to a maximum of 900 milligrams daily for those with normal kidney function. If your gout diagnosis is uncertain, or if standard treatments aren't working or are contraindicated, your doctor might refer you to a rheumatologist, a specialist in joint diseases. In cases where tophi cause significant discomfort or pressure, surgical removal might be necessary to relieve symptoms. We hope you found this video helpful in understanding gout, from its causes and symptoms to the latest treatment options. If you did, please give us a thumbs up, share this video with others, and don't forget to subscribe to our channel for more educational content. Thanks for watching and take care.